I see a lot of clients as well as I supervise the client services team. I also am connected with different agencies within the city, building partnerships, connecting with donors and volunteers, and just supporting our staff team as best as I can. I would definitely say my experience as a mom has affected my work here at the agency 100%. Early on in my pregnancy, I did struggle with postpartum anxiety and depression, and I had a C-section, so it was really isolating. I wasn't able to leave my house, similar to the situation that we're experiencing now. So it has allowed me to, again, reflect on the questions that I needed people to ask me, and that I did have people to ask me that led me to getting help from my doctor. But things like, how are you doing? How's your attachment with your child? How are you feeling as a mom and as an individual? So I think I just approach my practice now from a place that I just want to be honest, and I want to hear how people are actually doing. And I'm excited for people who are really flourishing in their role as a mom, but also I'm here and I'm willing to embrace the parts that are really challenging. We've seen a huge rise in domestic violence, as well as issues and concerns with mental health. Even rates of suicide have climbed since COVID has began. So it was really imperative that we are connecting with our clients even before they reach out for us. I think sometimes our clients were surprised when we'd call and just say, hey, like, we're thinking about you, how are you doing? Because I think in this age, there's lots of times people are busy. So when someone receives a phone call, just checking in, I think it was really meaningful for them to know that we are here. And I always finish my conversations and counseling appointments with just a, hey, if you ever need us, make sure that you're reaching out. We're here to support you. We have been able to reach out to clients again and check in and see how they're doing and offer them things that we originally didn't have before COVID. So our meal program, our clothing room shut down, but we were still willing to make boxes of clothing, and maybe it's not as ideal as being able to pick out your own stuff, but people are just so grateful and thankful that we're able to offer these things even though COVID has kind of shut down the world. It's been wonderful. We've gotten great feedback, and a lot of people have said things like, you guys have gone, like, you've really like made this period easier on my family, easier on me as a mom. I feel supported by you. So it's been overwhelming really how much positive feedback we've gotten back, and it's probably what's keeping us going. Our staff team has done an amazing job, and I feel extremely proud to be a part of this team. All areas of our center have really been working around the clock, and we have volunteers who are taking the phones throughout the night. Staff who are off hours are texting with clients to make sure that they're safe. And so it just feels like in this time where things are shutting down, our center has really opened up, and it's been so encouraging, and I love being a part of this team.